Hello everyone, and thank you for attending today's webinar introducing AHRQ's new Practice Facilitation curriculum. My name is Jay Crossan, and I'm a Senior Health Researcher with Mathematica Policy Research. Before we begin, I want to cover a few housekeeping items. Alex, next slide, please. At the bottom of your audience console are multiple application widgets that you can use. If you have any questions during the webcast, you can click on the Q&A widget at the bottom and submit your question. And we'll try to answer your questions during the webcast. And we do capture all of your questions. A copy of today's slide deck and additional materials are available in the resource list widget that looks like a green folder at the bottom of your screen. You can expand your slide area by clicking on the maximize icon on the top right of the slide area, or by dragging the bottom right corner of the slide area. If you have any technical difficulties, please click on the Help widget. It has a question mark icon and covers common technical issues. You can also submit technical questions using the Q&A widget. An on-demand version of the webcast will be available approximately 1 day after the webcast and can be accessed using the same audience link that was sent to you earlier. Now I'd like to introduce Bob McNellis, Senior Advisor for Primary Care at AHRQ. Bob, you now have the floor.
Great. Thanks a lot, Jay. Good afternoon, everyone, and thank you so much for joining us today. As Jay mentioned, I'm Bob McNellis, Senior Advisor for Primary Care here at the Agency for Healthcare Research and Quality, and it's my pleasure to welcome you to today's webinar. So this is the 6th time we've gotten together to talk about the curriculum since last August. And over the past year, I feel like I've gotten to know many of you as friends and colleagues. So let me just take a moment to review our journey together. In that first webinar last August, we set the stage by highlighting 3 exemplary practice facilitation training programs that informed our thinking about this curriculum. Last October, we provided a sneak preview of the draft EHR and HIT modules from the curriculum. In December, we described how various modules can help practice facilitators work with practice leaders to build a culture of safety in their practice. In January, we provided some insights on how modules from the curriculum can be used to help practices facilitate patient engagement, both in the patient's own care and the delivery of care in general. Then exactly 6 months ago, we introduced you to the curriculum by giving you a look behind the curtain at the new modules and how we expected them to dovetail with competencies for the growing practice facilitation profession. During that webinar, we also heard from leaders here at AHRQ and at the Center for Medicare and Medicaid Innovation about how this curriculum might address needs in the field, including AHRQ's new Evidence Now initiative and CMMI's Transforming Primary Care initiative. We sure have covered a lot of ground over the past 12 months. But today, the wait is over. There are no more teasers, no more sneak previews. This is the final webinar to preview the curriculum, and you'll be the first to see the curriculum in its final form. So next slide, please, Alex. Before we dive into the curriculum, I need to say a few words about AHRQ's work leading up to the development of the curriculum. Now, if you've joined us for previous webinars, you've heard much of this from me before, but I added a new twist or two just to try to keep it interesting for you experienced webinar attendees also. As you've heard me say before, AHRQ's mission is to produce evidence to make healthcare safer, of higher quality, more accessible, equitable, and affordable. The second, equally important part of our mission is to partner with others, like you and your organizations, to make sure the evidence is understood and used. Consistent with that mission, we believe that revitalizing the nation's primary care system is foundational to achieving high-quality, accessible, efficient health care for all Americans. Like you, we recognize that primary care is under pressure from many forces today: financial, regulatory, cultural, technological. We've invested in research to help understand the best approaches to support primary care practices as they transition from old models of care delivery to newer models that emphasize better patient outcomes, better experiences of care for patients and clinicians, and help lower costs. It's clear that many primary care practices, especially smaller practices, need outside expertise, or what we call an external infrastructure, to support them as they work through transformation and efforts to improve quality. We see practice facilitation as one important evidence-based strategy to assist practices as they move to delivery models like the patient-centered medical home. Next slide, please, Alex. A critical component of the PCMH, as defined by AHRQ, is a systematic focus on quality improvement and safety. but a broader, explicit commitment to ongoing improvement in primary care is needed, and primary care practices need help in developing their QI capacity. This graphic expands on what I mean by an external infrastructure. You see 5 broad categories of external supports can be effective in assisting practices in their QI work and helping them develop robust QI capacity. You see them here. They are data feedback and benchmarking, academic detailing or expert consultation, shared learning or learning collaboratives, electronic health record support, and lastly, practice facilitation and coaching. While these can be used alone or in combination, we believe practice facilitation is the secret sauce to quality improvement capacity because practice facilitators can help all the other supports fall into place and can assist with the ongoing quality improvement efforts needed to make substantive changes to care delivery. Next slide, please, Alex. Knowing the pivotal role practice facilitation can play in ongoing quality improvement, we undertook development of an expanded curriculum. This new curriculum builds on our current excellent practice facilitation handbook that was authored by Lindy Knox at LA-NET, who you'll hear from today, and Cindy Brock here at AHRQ. We added new modules and enhanced existing ones. We explicitly linked them with our competencies development. We created an instructor's guide focused on adult learning with suggestions about assessment, and have added many student resources and additional information to support the delivery of the curriculum through different modalities. Next slide, please, Alex. This graphic, when you see it, will depict the integrated approach we took to the development of the curriculum. For those of you who might have been wondering, what took so long? What have you been doing the past 2 years? Well, here it is. Together with our partners at Mathematical Policy Research and LA-NET, we began with an environmental scan where we developed exemplary training programs and began to uncover the core competencies for practice facilitators. We integrated the information from those exemplars with expert guidance on curricular design, worked to align competencies, learning objectives, and curricular content. Throughout the entire process, we engaged our technical expert panel to make sure we were on the right track for addressing the needs of the community. Meanwhile, we've engaged you through these webinars and through the Practice Facilitation Listserv, so you've been with us for every step of the way in the development of the model curriculum. Next slide, please, Alex. Oh, sorry about that one. That one animated a little bit, so you can just speed through those animations. There you go, till we get to the next one. So that'll be fun for someone to look at after the webinar. So in this particular slide, and I've shown this one before, depicts our current portfolio of practice facilitation products and how the curriculum slots nicely into the space between the how-to guide and the handbook. And so we won't linger on that one, Alex. Next one, please. It's also important for you to know that the curriculum is not the only product that's been in development over the past 2 years. Also, in partnership with our colleagues at Mathematica, we've released 2 white papers and associated briefs on using health information technology to support quality improvement and engaging primary care practices in quality improvement. Coming soon is a white paper on creating patient-centered team-based care. And by the way, there was an excellent webinar earlier this month that previewed that white paper. We think all of these documents could be helpful to practice facilitators, people who run practice facilitation programs, and anyone interested in quality improvement in primary care. Next slide, please, Alex. So as many of you probably know, AHRQ's PCMH Resource Center is your go-to website to get more information on all these products. As of today, you'll find a live link to the newly released curriculum, as well as the white papers, briefs, and other resources for supporting practice transformation. And you can see the web address there at the bottom. Next slide, please, Alex. So I've explained how involved the technical expert panel was throughout the entire process. We're extremely grateful to all of them, and the members are listed on this slide. They set us on the path to the start, have guided us along the way, and got the last word on its readiness to go live. And on behalf of AHRQ, I want to thank this impressive group of experts for all their time and contributions to the curriculum. Next slide, Alex. Of course, all of this would not be possible without the team at Mathematica and LA-NET. I specifically want to call out Dr. Jay Crossan and Dr. Lindy Knox, who you'll hear from shortly. They've done a tremendous amount of work to develop this curriculum, much of it from scratch. Cindy Brock and Jen Ginevro here at AHRQ also made significant contributions to the development of the curriculum. And you can see by the substantial number of contributors that you're not just getting an AHRQ product, but you're getting something developed by experts in the field. Next slide, Alex. Finally, on to today's program. Here you see our very basic agenda for the next 50 minutes or so. I took a little more than my usual amount of time, but as potential users of the curriculum, we thought it was important for you to know the background that guided its creation. Next, we'll share a little bit more specific information about its development. Then our lead authors, Jay and Lindy, will walk through a couple of the modules in depth with an eye towards how you might use them in a teaching session or for self-study. Then there'll be opportunities for you to ask questions about the curriculum, and we welcome and encourage those questions and comments. Next slide, Alex. So with that, here are the people who you're going to hear from today, and at this point, I'll turn it back over to Jay to get to the curriculum unveiling. So Jay?
Thanks, Bob. You can go to the next slide there, Alex. And then I think you can go on to the, there you go. So today, as Bob pointed out, we are releasing the expanded curriculum for training practice facilitators to prepare them for effective work with primary care practices. And I just want to reiterate this definition, which has guided a lot of our work as we've developed these resources, of what is a practice facilitator. Practice facilitators, as you probably know, are specially trained individuals who work with primary care practices to make meaningful changes designed to improve patients' outcomes. They help physicians and improvement teams develop the skills they need to adapt clinical evidence to the specific circumstance of their practice environment. Next slide. The core competencies needed by practice facilitators underlying the development of the curriculum have been identified, as Bob pointed out, by building on prior work funded by AHRQ. Some of that I want to point out here. The AHRQ 2010 Consensus Meeting on Practice Facilitation for Primary Care Improvement developed a list of competency areas needed by primary care practice facilitators. And this included a mix of content mastery, such as knowledge of primary care practice, diffusion of innovations theory, and organizational change, and applied skills, such as quality improvement methods, use of health information technologies, and communication. A subsequent guide, Developing and Running a Primary Care Practice Facilitation Program, authored by Lindy Knox and others, refined these core competencies to focus on interpersonal skills, generating and using data, and quality improvement or change management methods. And then building on these prior resources, the 2013 Practice Facilitation Handbook that Bob referred to before added practice assessment and health information technology optimization to the list of core competencies and began the process of creating instructional resources to support them. In preparing the expanded curriculum we're presenting today, we examined those prior resources, conducted the environmental scan, as Bob pointed out, and identified exemplar programs that we studied in depth. The actual case studies of those exemplary training programs are available in your resource widget. Next slide, please. The core competencies and objectives of the expanded curriculum continue the focus on mastering the content needed for practice facilitation, including knowledge of the primary care environment, of how organizations change, as well as the specific skills practice facilitators need to help practices make change, including facility with quality improvement methods, information technologies, and facilitating practice level meetings. For purposes of the expanded curriculum, we group these competencies into 4 domains of knowledge and skills that are needed for supporting primary care practice transformation. Foundational knowledge is familiarity with key topics important for improving and redesigning primary care, such as organizational change processes, the principles of the patient-centered medical home, familiarity with the changing primary care practice environment, including regulatory and policy changes. General skills includes competence in applying foundational knowledge to various transformation tasks, including basic quality improvement methods, assessing practice readiness for change, and people, project, and meeting management skills. Specialized skills includes competence in the use of specific techniques to support change, such as the use of information technology systems and work process engineering methods. Professional skills, knowledge, and commitment include developing competence in the use of effective communication techniques and in establishing trust with practice staff members, as well as knowledge of practice facilitation as a national community of practice and a commitment to lifelong learning. As a whole, the expanded primary care practice facilitation curriculum is intended to build competencies across all of these domains to support effective practice facilitation. And now I'd like to turn it over to Lindy Knox from LANet, who will talk about uses of the curriculum and walk us through one of the modules. Lindy?
Great, Jay. Thank you so much. And Bob, thanks for that great introduction. And what I'd like to do now for the audience is just take just a few minutes to walk through both some of the envisioned uses of this curriculum and potential audiences, and then also just give you a glimpse into one of the modules that hopefully will pique your curiosity and encourage you to download the full curriculum, which will be available on the AHRQ website. And then I think, Jay, is there a way for them to download it now during this session or immediately after?
Yes, from the resource list widget.
Great. So you all can be doing that also while we're talking about it. Next slide, Alex, please. So just to kind of orient the audience to the use of the curriculum, it's designed for new practice facilitators, but recognizing that people come into the world of practice facilitation from a variety of backgrounds and a variety of professional experiences. So it doesn't mean that they're brand new to the workforce. They may have actually worked for many years in other settings, or may also have worked for many years in a clinical environment as well. And so the curriculum is designed to be easily tailored to the needs of your learners. It has at the beginning, in one of the early modules, a professional self-assessment that a trainer could use or a program could use to assess its learners and determine what would be those modules that would best meet the needs of each individual learner. The delivery methods for the curriculum, there's a number of different ways that the materials can be used. It's really, one might think of it as a kind of a jumping off point for developing a multi-component training program. So it can be used online, and I'm going to talk in just a minute about how one program, Millard Fillmore at SUNY Buffalo, has been using this as an online webinar program. The materials can also be used for stand and deliver training, so classroom, traditional. Also can be adapted for use for self-study. We've had a number of practice facilitators who've actually helped us pilot some of these materials through self-study. And then one of the things that I particularly like, and we actually were inspired by some of the work going on in Vermont with Craig Jones and his team, where they were using materials from both the PF Handbook that Cindy and I developed and other sources to co-train practice facilitators and practices together. So that's another potential use for these materials. The curriculum modules that we're talking about today are really designed to be a foundational element of a multi-component training program. I think of it a bit as a kind of a starter kit to get you going quickly. The foundation really are these modules, and there are 32 of them. So you can pick and choose based, again, on the needs of your individual learners. Then you might want to add your own program-specific content. For example, if the quality improvement work that your particular program or your facilitators are involved in has to do with hypertension or improving diabetes care, then there might be additional content that you would add into these modules specific to those goals. Developing your own slide decks and additional resources, again, that may be locally grounded. And then adding field experience and preceptorships, because of course this is intended to be an introduction to practice facilitation, but not sufficient to get someone completely up to speed to go into a practice and work. And that would really happen through a combination of this training and then field experience along the lines of almost a preceptorship that you find in medical education. And then the other piece that you may want to consider adding to these modules is a learning community. And one of the things that is, in my mind, so magical about what practice facilitators can do is they're very good at identifying best practices or ways that particular practices have solved a problem, and then helping to codify that and spread it to other practices so that one person's success or one practice's success can support and inform the success of many. So setting up something like a listserv or some kind of online chat. I know that North Carolina has a very robust listserv that they run that facilitators from all across their state post to every day. And so they're continually learning from each other and also identifying kind of hot spots in the state or issues that are emerging in the practices that the facilitators can support each other in solving and also can alert their training director and their program director of. Next slide, Alex. So I mentioned briefly that the program Millard Fillmore, and I just want to walk you through, because this is a really excellent example of how a group has taken the modules, and in this case it was the first set of modules that Cindy Brock and I developed, and used it to help them start up a very robust training program. And so the way that they're using those modules, which are also in this new curriculum, so this new expanded curriculum includes those old modules plus many additional new ones. They're running 2-hour sessions 1 time a week, and it's a virtual training. It's live, but very much like this on a webinar, and they use a product called Blackboard. They have anywhere from 10 to 30 students joining in at a time on these sessions, and there's a chat function. They can raise their hands. They've had pre-reading that they've done based on the trainer's guide from the modules. So they come to those sessions prepared. There's a lead faculty member that was identified, June Levine, who had been doing practice facilitation training out in Los Angeles and now is doing some for Millard Fillmore. She comes on and facilitates both those sessions, but also brings in guest speakers periodically from really across the country to talk on special topics for the students. And so they took these modules, very much like the ones that you will hopefully download, and added slides. So June developed those slides to complement the modules and also to extend that content, because what she found during the sessions is students were raising local issues that were not specifically addressed in the modules, and so she added additional content to make them very appropriate for the different regions that people were joining from. She also developed some assessments to add to the modules so she could track student learning and progress, and also Millard Fillmore set up a group chat so that the students taking place, participating in these virtual sessions could chat with each other between sessions. And what was exciting about the way that Millard Fillmore has set this up is it allowed facilitators from anywhere across the country to join and participate in these trainings, and is a nice module, for example, a nice approach for a statewide training resource, for example, where it would be impractical for facilitators to travel in to a central location. They might do that, say, once every 3 or 4 months, but they could still continue to participate in weekly trainings and build their skills. Again, that was an idea that really grew out of some of our TEP member recommendations, and especially out of North Carolina, and how they've been supporting their statewide workforce of facilitators. And New York had also done something very similar. Also, as part of the Millard Fillmore training, there's a 1-week field placement that each student goes through. Oftentimes they're completing that in their own particular city. So Millard Fillmore will help them identify an experienced facilitator. That experienced facilitator will go through a little bit of a vetting process with the program to make sure that they have the skills and the knowledge to adequately precept that student, and then that student will be placed there. If for some reason that facilitator student does not have someone in their local environment, then there are 5 different practice-based research networks across the country that also have agreed to take these students in and provide them with a field placement for a week. So that's just one example of how someone has taken this curriculum to help build a very robust multi-component training program for facilitators. Next slide, please, Alex. So here's just a quick glimpse at their website at Millard Fillmore. Next slide, please. And then now what I would like to do is just very quickly give you guys a glimpse of one of the modules that is in this enhanced expanded curriculum. It's around building teams in primary care. Next slide, Alex. And first, a little bit about how we identified this particular topic as a competency. And this process was used with every module in this handbook or in this curriculum. Some of it came from the TEP, and you saw the wonderful list of participants that we had involved in advising the development of this product. All of them have been involved in some way or another for many years in practice facilitation and practice improvement. We also had some individuals that had been involved in the agricultural extension program and some of the outreach training going on there, and so they also advised us on how to structure the curriculum. We also had experienced facilitators from the field that were also on that TEP, but also we reached out to and asked them to tell us what were the issues they encountered as they worked with practices, what were their most frequently asked questions, what skill sets did they think they needed to adequately support their practices. We also engaged a number of practice leaders, CMOs from federally qualified health centers, leaders of small independent practices, who also advised us on content. And then we looked carefully at alignment with the patient-centered medical home model and national goals around practice transformation in PCMH. The content was developed very similarly, again, those same sources of impact, of input. And then in this particular module, one of our TEP members, Tom Bodenheimer, had done very excellent work in identifying the characteristics of effective teamwork in primary care, not just on patient care teams, but also quality improvement teams. Much of the work in practices takes place in teams, whether it's patient care teams or QI teams. And so he had done some excellent background work on this, and so that was heavily incorporated into this particular module. Next slide, please. So as we're shifting slides, I think of this training resource really as almost a curation of some of the best ideas, best tools, best resources out there. Whenever possible, we tried to draw on already existing content rather than reinventing the wheel. And so it's a very nice starting place to begin to look at what is some of the best in the best of working with practices in building teams, for example, or if it's a different module, the same thing. The resources were reviewed by TEP members, by the writing teams, and the best of the best was selected. So the module, each module starts with, it has a trainer's guide. The trainer guide provides some pre-reading materials that students should read prior to the session. It identifies the core competencies that are addressed by that module. It identifies the learning objectives that are also addressed in that module. And then it provides the trainer with some recommended activities that they can do with their either online class, in which case you would want to adopt them a little bit, adapt them, or boots on the ground delivery. And then a self-study student might be able to take those and still do them just on an individual basis. So here's just a little snapshot right here of some of the actual content of the module, which students are also asked to read, and it really gives every student just kind of a really quick overview of all of the different thinking in that particular topic, so in this case building teams, and also provides them with a list of excellent resources that they can go to help their practices and also to introduce their practices to. In some instances, a facilitator might even decide to take this module and use it themselves to train their practices. Next slide, please. So just again, kind of a review of the components of this module, but every module is structured in a similar way with an instructor's guide, with then the core module content, and then with the various resources that that facilitator might follow for additional learning or also share with their practices. Next slide, please. So here's a snapshot of the instructor's guide for building teams. And you'll see that it also provides a recommended time. So you know as the instructor how long it's going to take the students to do the pre-reading. You also know how long to plan each session. Next slide, please. So here's an example of some of the exercises and activities that are provided for the trainer or for that independent learner. And some of them are very engaging. For example, the curriculum may direct them to a TED video or to another resource online. Oftentimes they're video resources or wonderful articles such as the one I mentioned about that Tom Bodenheimer had developed that allow the students to begin to develop expertise and just understand what's available not only for their own learning, but things that they might eventually want to use with their practice. In this particular module, for example, one of our TEP members had a great deal of success using the waterline model when working with teams to improve their functioning. And so there's some an overview of the waterline model in the module, and then also a link to a very nice online YouTube video that would introduce the facilitators to this particular tool. Next slide, please, Alex. Here's a snapshot of some of Dr. Bodenheimer's work in this area that, again, the facilitators are introduced to, and then they can decide how they would like to share that with the practices. Next slide, please. These are some of the resources in the team module, and you see the links. And when the facilitators use this online, those links are actually hot links. So it makes it very easy for them to kind of toggle back and forth between these deeper tools and then this introductory module. So this module is almost a jumping off point to an array of different resources they might want to use. Another thing that's important to note, and Bob had brought this up to me, that it's really an important feature of this module, is there's a lot of cross-linking between each module. So content in this module on team building might also reference content in health IT implementation and optimization support that is relevant to teamwork. And so in that way, both the trainer and the student can jump back and forth between the content in this curriculum as needed. Again, kind of highlighting how easy this tool is to individualize for the needs of particular learners and also particular programs. Next slide, please. Some more resources. And then just to give you a brief glimpse, for example, we talked about how Millard Fillmore had used this. LA-NET also did a pilot of this module. And so one of the ways that we did that, we run a Project Echo Knowledge Network. And so we actually did an echo session around and using this particular module for our practices. And we just sent out an announcement to our listserv. We sent in a copy of the entire module to the attendees. We don't call them students, but the learners, and asked them to do the pre-work. Then it was a very simple matter of sending them a link to the webinar platform. We were using WebEx at that point in time for a noon training. And then we had one of our experienced practice facilitators moderate and deliver the training. And another thing that I think is very exciting to me about this resource is the fact that it's designed also for you to be able to tap facilitators already in your program or already in your local region and their particular expertise and bring them in as co-trainers with your program director or to lead the module themselves. Then we modified, in this case it was online, and so we modified the activity to use online. And then afterwards we sent out a SurveyMonkey, a very simple online survey, to get both their feedback on the session and to make recommendations for improvement. And that focus was really about piloting of this module and making it better for AHRQ. But someone using this real time for their own training might use that for the students to talk about what they learned and talk about what else they feel that they need more training on in that particular topic. Next slide, please. So I'd like to now turn the floor back over to Jay, and Jay is going to walk you through a second module that is also included in this curriculum. Jay?
Thanks, Lindy. I'm going to focus in on a different module, which is called the Patient-Centered Medical Home Principles and Recognition Processes. This is Module 25, and it focuses on the principles of the Patient-Centered Medical Home. And like the other modules in the curriculum that, as Lindy has pointed out, it has an instructor's guide, the module content itself, and then links to lots of additional resources. And while Lindy's focused on how to use a module in group settings, one of the things that we did develop the curriculum for was so that it could be used both online, in person in a group, and then also for independent study. And so this is one of those modules that I'm going to highlight how you might use it for independent study. Next slide, please, Alex. So the module focuses on helping primary care practice facilitators build their knowledge base in terms of both understanding the principles underlying the PCMH and the processes that the practices have to go through to achieve recognition in this area. And both are, of course, vitally important for practice facilitation work today. And as Lindy pointed out before, you can see approximately how long it's going to take for pre-session preparation for learners, and then how much time it would take if you were doing a group session. Now, one of the things that you could do in terms of adapting this for independent study would be that a learner would take those 60 minutes to read through the content and then be able to answer the issues that are covered there in the objectives on their own. Next slide, please. In terms of the content of the module provides basic definitions of the 5 principles of the PCMH: comprehensive care, a patient-centered approach, coordinated care, accessibility of services, and a focus on quality and safety, along with links to 4 of the most commonly encountered recognition programs that practice facilitators likely run into when they're out working with practices. While the module is offered with suggested group exercises, an independent learner could read the content, explore specific recognition programs independently, and then explore those programs independently in preparation for starting work with a practice that's beginning the PCMH recognition process. So that concludes our quick overview of how modules in the curriculum can be used or adapted, and now we'd like to turn it over to you for questions about the curriculum and what you can do with it. Next slide. And I just want to let you know, if we're not able to answer all the questions today, we will address them in future editions of the Primary Care Practice Facilitation electronic newsletter. And please remember that you can provide feedback via the survey widget. So, Lindy, I'll turn it over to you to answer some questions. Maybe you could expand a little bit on this question of how the modules could be used in different settings, such as a classroom or an online training platform.
Sure. Thank you so much for that, Jay. And please submit your questions as we're talking. The more the better, the more robust it makes this session. And I think I'm going to start with a question for Bob. And the question, Bob, is this new handbook meant to replace the earlier handbook, or should they be used together?
Great question, Lindy, and actually I'll let you even to provide some thoughts on that as well. But in many ways, this new curriculum incorporates nicely and updates the handbook. So I think the handbook still has great value. There's a lot of evergreen modules in there that have lasted the test of time, and I think will continue to be valuable. But still, this curriculum itself is more comprehensive in its approach. That being said, I think they can be used complementary depending on what your setting is. But I think I would start with the curriculum just because it's the most updated place right now. It sort of begs another question, I think, Lindy, and that is about how we're going to continue to update some of the content. So hopefully I'm not stealing a question for you in the future, but I know we've been giving some thought to how do we maintain the currency of the information that's in the curriculum. And although we don't have a formal updating plan, I think we're going to look to that. And I'd say in part of the design, we really looked to try to find material that wouldn't be time limited. That would be useful over the long term. So, for example, principles of change management, whether it's identifying workflow issues or understanding root cause analyses, things like that, building teams. I think that a lot of that material has a lot of lifespan to it. The PCMH recognition programs could change next year. HIT and EHR things move very quickly, so I think those will be a little trickier to stay on top of. But I think what we've got is the best we can come up with today, and we'll look for ways to keep it updated over time. And also, as you and your programs start to use this material, you should feel free to update it. These are available to you and use however you like in whole or part. So sorry for that long answer, Lindy, but I thought there were a couple issues there that we might talk about.
No, that's great, Bob. So here's another question. What was the total number of weeks for practice facilitator training? And you used the term student. Did you join the program with basic background? So the first question, I'm assuming, is referring to the Millard-Fillmore program, and their program is 12 weeks long. It takes place over 3 months, plus a preceptorship. But I think the duration of the training is really up to the individual program. So this is really designed both for practice facilitation programs that are freestanding. A health plan might want to pick this up to train an internal practice facilitator workforce for its contracted providers. It might be picked up by a state health department. For example, Oklahoma had an internal facilitation program that it placed out with its high-risk practices for a number of years. Vermont has done something very similar. So I think the duration of the training is really very dependent on the particular program. One thing that is important to understand is practice facilitator training should potentially and ideally be ongoing. So this is designed to bring people new to the field up to a certain level. But then once they're out working in the field actively, that training for them should be continuing, ideally on a weekly basis, where they're able to come to a training setting, either virtually or in person, and bring up the issues they're encountering in the field, and then receive additional training on those issues. And again, North Carolina is an excellent example of this kind of organic, constantly developing training based on the needs of their facilitators out in the field. And AHRQ has done several excellent case studies of training programs that are available on their website that could give you some ideas about how you might use this curriculum resource and also how you might design a larger training program. The second question, you used the term students. Did you join the program with basic background? The student for the training with this curriculum, and certainly for the Millard-Fillmore program, and I think for many of the others, for example, Health Teamworks in Colorado has an excellent training program. IHI does training in this area. There's a number of training programs across the country. The background of the students are varied. Some have had some clinical experience. For example, nurses oftentimes become interested in getting trained as a facilitator. In other cases, it might be someone with a master's in social work, PhD in psychology, master's in health administration, master's in public health. But also people that come to the training program may have bachelor's degrees or may be lay people. We've started out in Los Angeles doing some really interesting partnered facilitation with members of the patient community and doing what we call patient-partnered practice redesign. And many times these individuals may only have a high school education, and they are partnered oftentimes with a facilitator who's had more formal training. But again, I think it's up to the needs of your particular program. There's no gold standard for the type of background that one of our students should have. Jay, is there a question you see that you'd like to address from the list? We've got, you guys are doing great. Wonderful questions coming in.
Well, we had some questions, about can we get this now, and can we download it in PDF format? And the answer is yes. And you should be able to get it from the resource widget at the bottom of your screen, and also on the AHRQ PCMH website, which we will send you, which we'll have a link for that on our final slide if it's not in that resource list.
Great. So here's a question on what is the total amount of time suggested to complete all the modules. And again, I think that would be a program by program decision. On average, each module takes about 2 hours to deliver. The classroom training is typically about an hour, but some of them run as long as 2 hours depending upon some of the activities. And so I'd say on average there's about 64 hours worth of direct instruction that is provided through these modules. And then one could say about an hour to 2 hours of pre-study for the students. And then also if you're planning on doing a field training, anywhere from a week or, we had originally at the Millard-Fillmore program hoped to do a month, but then found that that just wasn't feasible for many people. So the week is where we landed to make it possible for people to get out in the field a little bit. But if you're providing this through an already existing program with facilitators that you've hired, you may have the ability to provide them a much longer preceptorship.
Hey, Lindy, I see one that I might tackle.
Go ahead, Bob.
Yeah, well, so I saw an interesting question that are you developing any condition-specific content for campaigns such as Million Hearts? And that's a really interesting question, and I would just I'll be slightly more expansive, I think, in my answer to that one. But I think the simple answer is no. Partly because what we wanted to create, as you described so nicely, Lindy, was this starter set of skills for practice facilitators. We really steered away from it, at least at this point, condition-specific information. But once a facilitator has this skill set, they could help a practice with any clinical condition, whether it's a Million Hearts condition around heart disease, which I know well from AHRQ's Evidence Now initiative, asthma care, care of people with chronic conditions, multiple chronic conditions. Any of those things I think would be helpful. And we haven't included any of that condition-specific stuff, but I think it could be adapted pretty easily to that. And I just want to pick up on one other thing that you mentioned earlier in your slides, and that was the idea of co-training between the practice and the practice facilitator. And I think that's fascinating because one thing that we haven't really talked about much is how these modules might be taken up by other health professionals, not just practice facilitators, but physicians, nurses, nurse practitioners, PAs, and others who work in the clinical environment to help them improve their quality improvement abilities. And I think there's a lot of potential there for the impact of these modules on some of those things as well. So again, a little bit more than what the question asked, but just thought I'd toss that out there.
Great, Bob, thank you. Jay, I think you had a question you were wanting to highlight.
Yeah, somebody asked if we had developed resources for engaging leadership to gain support for training staff and also for facilitation itself. Lindy, do you want to answer that? Because I know you were involved in developing those resources.
Yes, and that's a great question. And it was something that really was brought to our attention and was already in my mind because we struggled with that out here in Los Angeles, is really that critical role of getting practice leadership to buy in the use of practice facilitation, and then also to support both training of their own staff in quality improvement methods and in facilitation methods, and working with an external facilitator to help make all that happen. And so there was a module based on this input from facilitators, from TEP, from kind of our own lived experience out working with practices, that was specifically developed with that in mind. And it's a module around working with practice leaders. And it is designed to help facilitators both, one, understand what leadership looks like in a practice, what some of the issues are that leadership is dealing with, and then how to engage them effectively in kind of buying into practice facilitation support, and then helping them build and introduce a culture of quality within their own practices. It's actually one of my favorite modules. So I'm very glad somebody asked that question. Let's see, there is a question also about the self-assessment that was mentioned. And that is available in one of the early modules. It's actually in the Introduction to Practice Facilitation module and an overview of the process. And it's in the appendix. And so you'll be able to access a copy of it and download it and then use it, adapt it, and use it for your own purposes. Bob or Jay, other questions that you guys are seeing that you'd like to address?
Sure, Lindy, I'll jump in because I saw at least a couple about examinations and certification. And I just want to make sure that we're specific that AHRQ is not an education organization. So what we've done is dedicated resources to developing the curriculum, but we're not really taking the profession to the next level. We're not creating an examination or certification program, but we welcome institutions, whether they're universities or other programs, who want to take this up and use this as core to some of those types of programs. We welcome that. But just to be clear, AHRQ is not offering any educational credit or any certification or anything like that with this curriculum, but still we hope it'll get taken up by others who can do that.
Excellent. Jay, any that you're seeing that you'd like to address?
Well, I saw one that I thought would be another good one for you to address, which is
Go for
that,
it.
yeah, so people are one of the big challenges with working with practices and any organization in terms of organizational change is readiness to change. And maybe you could talk a little bit about how we've developed resources for assessing that and dealing with that issue.
Sure. So the one about my concern is organizations' willingness to change, and how do you prepare people, facilitators, for this very real circumstance. That this issue is really addressed kind of repeatedly through the modules. And one of the things that the modules include is some training for facilitators in assessing a practice's readiness to change. Do they have kind of sufficient, the term that started being used several years ago, adaptive reserve, to engage in quality improvement work, or are they struggling with such basic needs that quality improvement activities might not take root at that moment in time? And so there's some training and some even kind of informal assessment tools that a facilitator can use to, as they begin to work with a practice, to determine if that practice is ready to change. The other thing that's present in these modules is a lot of discussion around how a facilitator can meet a practice where they are. And my favorite story of this, and use that to build capacity, my favorite story is one that Anne Lefebvre tells about one of the most unique access issues she's ever had in a practice. When they arrived to begin to work with this practice, they asked, what are you concerned about? And the practice said, well, we'd love to include our diabetes, improve our diabetes measures, but we've got a real problem that we don't know how to solve and we need your help. We've got geese in our parking lot and they keep biting our patients before they come into the practice, and now our patients are afraid to come see us. And so it seemed like kind of an odd place for a facilitation intervention to start, but these facilitators have been trained in meeting a practice where they are, and that's very important in building buy-in, and this is all present in this curriculum. And so they worked with that practice to do a PDSA cycle, so they introduced them to the model of improvement, and they did PDSA cycles around the geese, and they discovered the woman who lived next to the practice had become sick, and she was in the hospital, and she'd stopped feeding the geese, and so they'd moved into the parking lot. And so then they developed an intervention and tested it to have the next door neighbor to that woman begin to feed the geese. And sure enough, the geese moved out of the parking lot and back into those yards. And they solved this access problem. But what was more important was the practice began to understand the quality improvement process and build their own capacity there. And so there are anecdotes like that and kind of training for the facilitators to help them begin to think that way as they go and work with practices. Of course, that always has to be balanced with also the deliverables and the demands for that particular program. And that is something that is addressed in the modules, but also requires kind of ongoing training and support for facilitators to be able to make good decisions about those issues.
Lindy, if I might just piggyback on that a little bit, I don't have a great geese story to tell along with it, but it does give me an opportunity to highlight one of the AHRQ references I talked about in my comments, and that is, engaging primary care practices in quality improvement and some strategies for that. So not everything may not be in the curriculum, but there's tons of resources that are connected with it, like this new white paper that actually lays out a framework for engaging practices, figuring out where they're at, and some really specific strategies about it. And that paper is on AHRQ's PCMH Resource Center. And so that would be another nice way to get some additional information beyond what's in the curriculum about engaging those challenging types of practices.
Excellent.
Lenny,
go ahead, Jay.
Just to close the loop a little bit, Module 18 is about assessing practice readiness for change. So that would be where you'd find those resources.
So I see a question here that is also a good one. How do we integrate telehealth into the training modules of the practice facilitator? There are several modules on health IT and introducing practice facilitators to the use of technology within practices, both EHRs, but also addresses to some degree telehealth. But I want to make the observation here also that you could think of many of the skills that are included in these modules as almost like the capsule for delivering the medicine. And so that medicine might be telehealth, or it might be new hypertension management guidelines, or it might be improved self-management support for patients. And what the modules really teach a facilitator to do is how do you go and identify the useful resources that a practice needs in that content-specific area, and how do you work with a practice to set up their teams and work effectively as teams, and to implement and test those changes, and to evaluate the impact on patient outcomes, and all of those different processes that are needed regardless of what the content is that's getting delivered. So that would certainly hold here with helping a practice adopt and use more effectively telehealth resources in their community. Bob or Jay, would you want to add anything to that particular comment?
Not for me. That's right on. Thank you, Lindy.
Yeah, I think
excellent. Any other last questions? We only have about 5 minutes left, so I think we probably have time for one more. Jay or Bob, do you see one that we should address?
Yeah, there's a few good ones here. So I think, for example, there's that one about the PCMH 2014 maybe requirements, I think, about care coordination and population health. That might be an interesting one to tackle. And maybe I'll just start by saying I think what the curriculum doesn't necessarily do is provide necessarily the resources for somebody to specifically meet PCMH recognition standards. But what it does do is provide a framework and a broad range of tools that will generally allow practices to focus on the things they need to do to get the kind of recognition that they're interested in, or just increase their functionality as a primary care practice. So Lindy or Jay, do you have things you think might you add to that?
Well, I think if we go back to the beginning of what we talked about in terms of the skills and competencies that this curriculum is focused on, it's really focused on building the competencies of the facilitators who would work with the practices to accomplish that recognition. And the kinds of skills that facilitators will develop through using this curriculum can be translated to lots of different practice change initiatives, and certainly to that one.
So, and what I would add to that, Bob and Jay, is there are modules that introduce the facilitators to meaningful use, for example, and the requirements of meaningful use, and direct them to a number of resources that a practice might use when they're working on that area. It also introduces them to the different approaches to assessing PCMH and the different models for determining what level a practice has reached in PCMH. It provides modules that introduce the facilitator to empanelment, to panel management and population health activities, how to generate those reports off of their EHR systems, how to work with a practice to empanel, or oftentimes practices have empaneled and then had trouble with it, so how to help them correct that. And in those modules, there are links to really outstanding, robust training materials from across the country. For example, the McCall Institute has been able to put up some wonderful training resources, for example, for retraining MAs when you start shifting to patient care teams. There's an excellent module in this curriculum that introduces facilitators to setting up care teams in a practice and then optimizing them. So just because they're set up doesn't mean they're working well. So it teaches them, introduces them to ideas of things like huddles and tasking. And then it also directs them to these resources at the McCall Institute for their full-blown training curricula for retraining MAs in, for example, population health management roles and outreach roles. And so it's, again, a very good jumping off point for a facilitator to bring these resources to a practice. And with that, I'll stop because I see we're right at the end of the hour and hand it back to Jay and Bob.
Okay, thanks, Lindy. Alex, can you go to the next slide there? So I want to thank you all for attending the webinar today, and this is concluding our webcast, and you can see here the link for the practice facilitation curriculum that we've been talking about, so please feel free to download it. It is free and you can use it starting today. And if you want more information, please subscribe to the practice facilitation listserv using the instructions there. Just send an email to us. And you can listen to any of our first 5 webinars in this series on the case studies, use of health IT, supporting patient safety, patient engagement, and the original introduction to this curriculum. And you can also go to the case studies that we referred to earlier on. And so please submit your feedback to our presentation team in your browser window when the event concludes. And if you're unable to provide your feedback at this time, you can view the on-demand recording of the event and access the survey widget there. The on-demand will be available approximately 1 day after the webcast and can be accessed using the same audience link that was sent to you earlier. Thank you and have a great day.